Patients in Sidelying, if I choose to do, and for me, the way I do it in clinic, if I'm going to do this, the patient's painful side is up, so in this case, right side. I always use my cross finger technique. I told you guys about that before last time. Okay, so I start to work the soft tissues from you can do medial a lot to lateral, or from lateral to medial. There's a few different ways of doing that. Okay, one way I like to do in clinic though, and it's just a little bit easier, is when I come medial to lateral. What I also do at the same time is I start to separate the rib cage and apply an up glide to her lumbar spine, and then I'll come off of that. Again, I'll apply pressure, and while I'm imparting the up glide, I'm also coming lateral. So now I'm on the lateral portion of her muscles, and then when I'm done, I come back to the beginning, apply pressure, and so just repetitively.
So you're kind of using your forearm there too.
I'm using my forearm on the rib cage as well as right at the greater trochanter to create this. Okay. If she's more painful from above, the rib cage is just, I mean, I can just do one side. That way. Just easier for me than doing the opposite, which is trying to approximate. It's doable. It's a little bit tougher. Which way do you like? The first way better, yeah. So I mean, just maybe because I'm more practiced at it. This is very natural to me. I just do this a lot with my low back patients. This one I don't do so often, so I probably just have to work at getting better at that. But that's another technique, especially for the lumbar spine, I like to do. So why don't we break up into groups? Think again, and again, the same thing. I actually end up starting in the middle. I take up some tissue sites, and now I'm right off the spinous processes. So that way, as I'm coming lateral, I have a lot of subcutaneous mobility in my favor to work on that. Okay? All right.